Hey everyone, and welcome back for another deep dive. Today we're going to get into something that I'm sure a lot of you have dealt with, and that's back pain.
Yeah, back pain, we're going to take a close look at it. All the causes, different management strategies, and, how do we know when it's time to actually go and see a doctor about it? And joining me today for this is, well, I'm super excited about this. We've got some fascinating insights here from places like the World Health Organization, the American Association of Neurological Surgeons,
Yeah.
and, of course, the National Library of Medicine.
Yeah, it just seems like everyone experiences back pain at some point in their lives. It's kind of just one of those things. But, it's interesting because we often think of it as just a minor annoyance.
Uh-huh.
But the WHO actually says that lower back pain is one of the leading causes of disability worldwide.
Wow, like a leading cause of disability. That's pretty serious. We're not just talking about like I tweaked my back, doing yard work. We're talking like this is and it can be really debilitating.
Yeah.
In the National Library of Medicine, they highlight how chronic lower back pain can really affect you mentally and just your overall quality of life. It's not even just the like physical discomfort. It's like, your mood, your sleep, your work, your ability to like enjoy activities.
Right. It's just like, if you're in constant pain, it's hard to enjoy anything. It's hard to focus on anything.
Yeah.
So let's talk about what causes it then. I'm guessing there's a lot of different things that can cause back pain.
Yeah, there are. Some of the most common causes are muscle strains and sprains. And that can be from, overdoing it, like weekend warrior syndrome. And even just like an awkward twist or a sudden turn can do it.
Yeah, I've been there, done that.
Yeah.
And it is not fun. It's those like, you don't realize it's going to happen. It's just like.
Yeah, and then there's herniated discs. And this is where the soft, jelly-like center of an intervertebral disc, it pushes through its outer layer. And sometimes it presses on nerves, and that can cause pain.
Oh, man, that sounds rough.
Yeah, and then there's arthritis, which brings degenerative changes in the spine. And of course, we can't forget about posture. I'm sure we've all slouched a time or two.
Oh, yeah. Yeah, I'm definitely guilty of that. So, okay, we've got some of the causes there. But what I'm interested in is like, okay, so we've got this back pain now. How do we manage it? And it sounds like it's not a one-size-fits-all thing, right?
No, it's not a one-size-fits-all. The key is finding a multifaceted approach that works for you. Physical therapy is often a cornerstone of back pain management.
So it's more than just popping some ibuprofen.
Exactly. Physical therapy involves tailored programs to strengthen back muscles, improve flexibility, and build core stability. So we're talking stretching, yoga, core strengthening exercises, all that comes into play.
Right, because you have to address the muscles that are causing the pain. Now, what about like pain relief? Like when we think about back pain and we think about like over-the-counter NSAIDs, ibuprofen, naproxen, Aleve.
Right. And those can be effective. Those can be effective for reducing pain and inflammation. But, you always want to use them responsibly. And talk to your doctor if you have any concerns or if you're just not experiencing any relief from them.
Right. Because you don't want to just mask the pain. You want to actually like fix the problem.
Yeah.
So what about like other pain management techniques? I've heard about heat therapy and cold therapy.
Yeah. Heat and cold therapy can be effective. Applying ice in the beginning, the initial stages, that can help reduce inflammation. And then later on, heat, like heating pads or warm baths, can help relax the muscles and reduce pain.
Simple but effective.
Yeah.
What about posture correction? I think we all know we should have better posture, but it's so easy to like, just kind of slouch over.
Yeah, and I think that's something we all struggle with. But, even small changes in posture can make a big difference. Like investing in an ergonomic chair, an ergonomic desk setup, and even just thinking about how you stand, making sure that your weight's evenly distributed. These are all things that can help reduce the strain on your spine.
It's interesting that something as simple as how you stand can play such a role in back pain. So let's talk about ergonomic workspaces. I think that's something that a lot of people can benefit from hearing about. What are some of the things we should be thinking about?
So lumbar support is crucial. So when you're looking for a chair, you want something that supports the natural inward curve of your lower back. And adjustability is key too. You want a chair that allows you to customize the height so that your feet are flat on the floor, your thighs are parallel to the ground.
So it's not just about comfort, it's about like aligning your body correctly.
Right. And then your desk. Ideally, you want a desk that allows you to alternate between sitting and standing throughout the day. The standing desks are becoming very popular because they encourage movement and they prevent prolonged sitting, which can really be bad for your back.
So even with a good chair, you still need to get up and move around. What about things like your computer monitor? I imagine that plays a role too.
Yeah. So your monitor should be positioned directly in front of you, about an arm's length away, with the top of the screen at or slightly below eye level. This helps prevent neck strain, which ultimately can affect your back as well.
So everything's connected. What about things like keyboards and mice? I've seen those ergonomic ones. Do
Yeah,
they really make a difference?
they absolutely can. They're designed to reduce strain on your wrists and hands, which can in turn impact your posture and back health. So like, for example, a split keyboard encourages a more natural wrist position, which reduces the risk of carpal tunnel syndrome.
So it's all about like setting up a workspace that's going to like work with your body, not against it.
Exactly. And the good thing is that setting up an ergonomic workspace doesn't have to be expensive or complicated. Even small adjustments can make a big difference, like adding a lumbar support pillow to your chair or adjusting the height of your monitor. Those small things can really help.
Right. It's about being aware and making those little changes throughout the day so that you're not just like, constantly hurting your back.
And you know that. That brings us to lifestyle choices as well.
Right, because it's not just about how we're sitting, it's about, our overall lifestyle. So what kind of lifestyle changes can we make that are going to have a positive impact?
One of the most important things is maintaining a healthy weight,
Hmm.
because excess weight puts additional stress on your spine, and that increases the risk of pain and injury.
So just generally taking care of your body is good for your back.
Yeah, what about diet?
Diet. Yeah.
Does that affect back health?
I mean, I'm sure it does.
Yeah, so a balanced diet,
Hmm.
rich in fruits, vegetables, lean protein. That provides the nutrients your body needs to maintain strong bones and muscles, including those that support your spine.
So it's about nourishing your body from the inside out. What about sleep? I know sleep is important just for general health,
It is.
but does it affect our backs?
Sleep is when our bodies repair and regenerate. So when we don't get enough sleep, our muscles don't have adequate time to recover, and that can lead to tightness, soreness, and an increased risk of injury.
Right, because your muscles aren't getting that time to
Yeah.
rebuild and recover. So healthy weight, balanced diet, enough sleep.
Mm-hmm.
Those are all important. What about the mind-body connection? How does our mental and emotional state, how does that affect our back?
That's where things get really interesting. So our sources highlight the impact that stress can have on back pain. When we're stressed, our muscles tense up, our breathing becomes shallow, and this can actually intensify pain signals.
So it's not just like all in our head. Like stress actually has a physical impact.
Right, and dirt. That's why incorporating relaxation techniques into a back pain management plan can be so beneficial.
What kind of relaxation techniques are we talking about?
So there's a lot of different approaches, but some of the most effective include meditation, deep breathing exercises,
Mm.
and even yoga. These practices can help calm the nervous system, reduce muscle tension, and promote a sense of well-being.
So it's good for the physical and the mental side of things. Are there any like specific techniques or programs that you recommend?
One program that stands out is mindfulness-based stress reduction, or MBSR.
MBSR, I've heard about mindfulness, but how does that apply to back pain?
So MBSR, it isn't just about relaxation. It involves developing a different relationship with the pain. You learn to observe your pain without judgment, which can actually reduce its intensity.
How does just observing the pain make it better?
Imagine holding a hot coal. The more you clench your fist around it, the more it burns. But if you gently open your hand and simply observe the sensation, the pain starts to lessen.
So it's almost like you're detaching yourself from the pain in a way.
Exactly. And one of the remarkable things about MBSR is that it can help people reduce their reliance on painkillers. In fact, there was a study published in the Journal of the American Medical Association that found that MBSR was as effective as medication for reducing chronic back pain.
Wow. So there's actually scientific evidence to back this up.
There is.
It's not just a bunch of hippy-dippy stuff.
And beyond pain relief, MBSR can also help improve sleep quality,
Yep.
reduce stress and anxiety, and promote overall well-being.
Wow. So this is like a secret weapon against back pain.
It can be.
So we've got, physical therapy, we've got exercise, we've got lifestyle modifications,
Yeah.
now we've got mindfulness techniques. But at what point do you know, okay, I need to actually go and talk to a doctor about this?
Yeah, that's a great question. If your back pain is persistent,
Yeah.
or it starts to worsen despite your efforts to manage it, it's definitely time to reach out to a healthcare professional. They can help diagnose the root cause of your pain and recommend the most appropriate treatment options.
And I imagine there's different types of healthcare professionals that can help with back pain. It's not just a matter of seeing your general practitioner.
Right, your primary care doctor is a great starting point, but they might refer you to a specialist. Depending on the nature and severity of your back pain, for example, they might refer you to an orthopedist, a physiatrist,
Mm.
or a neurologist.
Okay, so let's break that down. What do those different specialists do?
So an orthopedist is a surgeon who specializes in the musculoskeletal system. So that's your bones, your joints, muscles, tendons, ligaments. And they're experts in diagnosing and treating conditions that affect these structures, including those that cause back pain.
So if you have a back problem that might require surgery, that's who you would go see.
Exactly. They can assess whether surgery is necessary and perform the procedure if it is. But it's important to note that surgery is typically considered a last resort, only after other treatment options have been exhausted.
Okay, so that makes sense. What about non-surgical options? Are there other specialists that focus on those?
Yeah, so a physiatrist is a doctor who specializes in physical medicine and rehabilitation. And they focus on restoring function and improving quality of life for people with injuries or disabilities.
So they're kind of taking a more holistic approach.
Exactly. They look at the whole person, not just the specific injury or condition. And they might use a combination of treatments, including medication, physical therapy, injections, and assistive devices to help you regain mobility and independence.
So it's not just about like fixing the immediate problem, it's about like getting you back to your normal life.
Exactly.
Are there any other specialists we should mention?
Yeah, so for back pain, that's related to nerve problems. You might be referred to a neurologist. Neurologists specialize in the nervous system, so the brain, spinal cord, and nerves.
So if your back pain is caused by like a herniated disc that's pressing on a nerve, that's when you'd see a neurologist.
Exactly. They can diagnose and treat conditions that affect the nerves, including those that cause back pain.
So it's important to figure out what's causing your back pain so that you can see the right specialist.
It is.
This is really helpful information. Okay, so let's say you've seen a specialist and they have recommended physical therapy. What can you expect from physical therapy for back pain?
So physical therapy for back pain is highly individualized. The therapist will assess your specific needs and develop a program tailored to your condition and goals.
So there's no like one set of exercises that everyone does.
Right, it depends on the cause of your back pain, your level of fitness, your lifestyle, things like that.
So what are some common things that are done in physical therapy for back pain?
Well, one of the primary focuses is strengthening your back muscles, because strong back muscles provide support for your spine and help prevent further injury.
So what kind of exercises would you do to strengthen your back?
There are all lots of different exercises that can help. Some common ones include planks, bridges, and rows. These exercises target the muscles that support your spine and help stabilize your core.
Okay, those sound familiar. What about flexibility? Is that addressed in physical therapy?
Absolutely. Flexibility is crucial for maintaining good posture and preventing muscle tightness, which can contribute to back pain. So your therapist will likely incorporate stretching exercises into your program.
What kind of stretches are helpful for back pain?
So there are a lot of different stretches that can help. Some examples include knee-to-chest stretches, cat-cow stretches, and hamstring stretches. These stretches can help improve flexibility in your back, hips, and legs.
So it's not just about stretching your back.
Right.
It's about stretching the muscles around your back.
Exactly, because your back is part of a complex system of muscles and joints. So it's important to take a holistic approach to stretching.
What about core strength? I know that's something that's often emphasized for back health.
Yeah, so your core muscles, which include your abdominal muscles and back muscles, they act like a corset, providing stability for your spine.
So if you have weak core muscles that can actually contribute to back pain.
Absolutely. If your core muscles are weak, your spine is less supported, which can lead to strain and injury.
So what kind of exercises can we do to help strengthen our core?
So planks are great for core strength. Also bird dog, bicycle crunches, and side planks can all help strengthen your core muscles and improve stability.
This is all really good information. I'm feeling a lot more informed about how to take care of my back already.
Good. I'm glad.
One of the things that's really striking me as we talk about this is just how interconnected everything is. We've got the physical therapy, we've got the exercises, we've got posture, we've got ergonomics, we've got stress management, we've even got mindfulness. It all seems to tie together.
Yet it does. You know, back pain, it's rarely caused by just one single factor. It's often a combination of physical, lifestyle, and psychological factors. And that's why a multifaceted approach to treatment is so important.
So it's like you need to address all these different pieces of the puzzle. To really find relief and prevent future problems.
Exactly. It's about creating a lifestyle that supports your back health in every way.
I like.
And that includes paying attention to your physical habits, managing stress, and cultivating a positive mindset.
So it's not just about treating the symptoms, it's about like really addressing those root causes
Exactly.
and making sustainable changes that are going to benefit your overall well-being.
It's about taking a proactive approach to your back health and empowering yourself to live a pain-free life.
Okay, so we've talked about physical therapy, exercise, lifestyle changes, but what about when the pain is really bad? What about pain management?
Yeah, so pain management is a crucial part of the overall treatment plan for back pain. It's not just about masking the symptoms. It's about creating an environment where your body can heal and recover more effectively.
So what are some options for pain relief? We've talked about over-the-counter pain relievers, but are there other medications that are commonly prescribed for back pain?
Yeah, so if over-the-counter medications aren't providing sufficient relief, your doctor might prescribe stronger pain relievers, such as opioids.
Opioids. Those are pretty strong
Yeah.
painkillers.
They are. Opioids are very effective at relieving pain, but they also have serious side effects, including the risk of addiction, so they're typically prescribed for short-term use, and only when other pain management strategies haven't been successful.
So it's not something that you want to be taking long term.
Right.
What about muscle relaxants? Are those sometimes used for back pain?
Yeah, muscle relaxants can be helpful for back pain that's caused by muscle spasms. They work by reducing muscle tension and tightness, which can alleviate pain and improve mobility.
So medications are an option, but it sounds like they're often used in conjunction with other therapies.
Exactly. It's rarely a matter of relying solely on medication. A comprehensive approach to back pain management typically involves a combination of strategies, including physical therapy, exercise, lifestyle modifications, and pain relief as needed.
And we've talked about some of those other strategies, like physical therapy and exercise, which can help address those underlying causes of back pain and strengthen the muscles that support the spine.
Right, and then there's lifestyle modifications, like improving your posture, creating an ergonomic workspace, maintaining a healthy weight. All of these things can help reduce strain on your back
Yeah.
and prevent further injury.
So it's like a fruit. It's like you need to be doing all these things to really create a good environment for your back to heal.
Yeah, and then there's stress management and mindfulness techniques, because stress can really exacerbate back pain. So finding healthy ways to manage stress, like meditation, deep breathing, or yoga, can be very beneficial.
So we have to look at all these different areas, our physical health, our mental health, our lifestyle. It all ties together.
It really does. Back pain is a complex issue, and there's no one-size-fits-all solution. But by understanding the different factors that contribute to back pain and the various treatment options that are available, we can empower ourselves to find relief
Yeah.
and live healthier, more fulfilling lives.
And one of the things that I'm taking away from this is that, it's never too late to start taking care of your back. So whether you're experiencing back pain right now, or you just want to prevent future problems, there are steps you can take today to improve your back health.
Absolutely.
So what are some simple things people can do to start incorporating back healthy habits into their daily lives?
So one of the easiest things you can do is just pay attention to your posture. Make sure you're sitting and standing with a straight back, shoulders relaxed, and head level.
So no more slouching.
No more slouching. And when you're lifting heavy objects, remember to lift with your legs, not your back.
Good advice. What about exercise? What kind of activities are good for back health?
So walking, swimming, and yoga are all excellent choices. They strengthen your back muscles, improve flexibility, and promote good posture without putting too much strain on your spine.
So those are good starting points for people who are maybe not that active right now. What about people who are already pretty active?
Right.
Are there certain exercises they should focus on?
So for those who are already active, incorporating exercises that strengthen the core muscles, such as planks, bridges, and bird dog, can be really helpful for supporting back health.
Building that good foundation.
Exactly.
And just remembering consistency is key. You don't have to, spend hours and hours at the gym.
Wow.
Just a little bit every day can make a difference.
Right.
Okay, one last thing. We've talked a lot about the physical aspects of back health, but what about the mental and emotional side of things?
Yeah.
Any tips for managing stress and cultivating a more positive mindset?
One of the simplest yet most effective ways to reduce stress is to practice deep breathing. Just take a few deep breaths, focusing on the sensation of your breath entering and leaving your body. It's amazing how such a simple technique can calm your nervous system and ease tension.
Yeah, deep breathing, it's so simple we forget about it.
We do.
What about if you're looking for something a little more structured?
Yeah, if you're looking for something a little more structured, mindfulness meditation is a wonderful practice. Even just a few minutes of meditation each day can help you develop greater awareness of your thoughts and feelings, reduce stress, and improve your overall sense of well-being.
Okay, so it's not just about taking care of our physical bodies.
Right.
It's also about taking care of our minds and our spirits as well.
Absolutely. Back health is a journey, not a destination. It's about making conscious choices each day that support our overall well-being. And remember, there's no shame in seeking help when you need it. There are many resources available, from healthcare professionals to support groups to online communities that can provide guidance and support on your path to a healthier back.
And that actually brings us to another important point, which is knowing when to seek professional help for back pain.
Exactly.
So, while all of this stuff we've been talking about is great, when do we know that we need to actually go see a doctor?
Yeah, so while self-care strategies can be incredibly effective, there are times when it's essential to reach out to a healthcare professional.
So what are those red flags?
If your back pain is severe and it doesn't improve after a few days of home care, that's definitely a sign to seek medical attention.
Okay. What about other warning signs?
If you're experiencing numbness, tingling, or weakness in your legs or feet, that's a major red flag. It could indicate nerve compression or damage, which requires prompt medical attention.
That sounds serious.
It can be, which is why it's so important to get it checked out. Another red flag is if your back pain is accompanied by fever, chills, or unexplained weight loss. These symptoms could point to an infection or other underlying medical condition that needs to be addressed.
So those are signs that something else is going on.
Yeah.
What about back pain that's been going on for a while, like several weeks or months?
Yeah, so even if your pain isn't severe, if it's persistent and interfering with your daily activities, it's worth seeing a doctor. They can help determine the underlying cause and recommend the most appropriate treatment plan.
So it's about listening to your body
Yeah,
and not just trying to push through the pain.
exactly.
Yeah.
Sometimes we need a little extra help to get back on track.
This has been such an informative conversation. I feel like we've covered so much ground. We've talked about understanding the causes of back pain. We've talked about all these different management strategies, conventional, holistic.
We have.
It's been great.
It has.
And there's a lot for people to think about and consider.
There is.
You know, what were you doing before we started this? Were you sitting at your desk, hunched over your computer? Were you driving in your car? Were you?
Yeah. It's funny how we don't realize how much strain we're putting on our back until the pain forces us to pay attention.
Exactly. So I want to leave our listeners with this challenge. Take a moment right now. Check your posture.
I like it.
Are your shoulders slumped? Is your back rounded? Just that simple act of bringing awareness to your body can make a big difference.
Small adjustments can have a ripple effect throughout your day.
Absolutely. And remember, managing back pain is a journey, not a destination. It's about making those consistent efforts, those small changes that add up over time.
Yeah, it's about creating a lifestyle that supports your back health in every way, physically, mentally, and emotionally.
And one of the most empowering things we've learned today is that you don't have to suffer in silence. There are so many resources available, from healthcare professionals to therapists to online communities.
Yeah, reach out, connect, and keep learning. There's a whole world of support out there.
This has been a really great deep dive. I hope that people are walking away with a lot more information, a lot more sense of like, okay, I can actually do something about this.
Back pain doesn't have to rule your life. You have the power to take control and reclaim your well-being.
It's been a pleasure diving deep with you today.
The pleasure was all mine. Until next time, take care of yourselves and those incredible backs of yours. So think about it this way. How is your back pain limiting you right now?
That's a good question. Yeah, we tend to think about the pain, but we don't always think about, like, how it's affecting us.
Exactly. Like, what activities are you putting off or avoiding because of your back? Is it gardening, playing with your kids, or even just, like, going for a walk?
Yeah, it's those things that we take for granted, and then when you can't do them, it's like, oh.
Right. So addressing your back pain isn't just about eliminating the discomfort. It's about reclaiming those experiences, those possibilities.
Getting back to living.
Exactly.
Now, I do want to go back to something we were talking about earlier, the medications for back pain. We talked about over-the-counter stuff, prescription painkillers. But what about injections? I've heard about those. I think they're called corticosteroids.
Yeah, corticosteroids. They're a type of powerful anti-inflammatory medication that can be injected directly into the affected area.
So how is that different from like, ibuprofen, which also reduces inflammation?
So they both reduce inflammation. But corticosteroids are much stronger, and they work more quickly. They're often used for more severe cases of back pain, especially when inflammation is a major factor.
So if you have a herniated disc, for example, and there's a lot of inflammation around the nerve, they could inject a corticosteroid into that area.
Exactly. It can be very effective for providing short-term pain relief and reducing inflammation, which gives your body a chance to heal. But it's not a long-term solution.
Right. It's more about like managing the pain while you're doing the other things like physical therapy or making lifestyle changes.
Exactly. And speaking of physical therapy, I want to emphasize the importance of core strengthening exercises.
Yeah, we talked about core strength, but I think we could go a little deeper into that. Why is a strong core so important for back health?
So imagine your core muscles, like your abs, your obliques, and your back muscles. Imagine them as like a natural corset that supports your spine.
Okay, I like that, a corset.
Yeah,
So if our core is weak, our spine doesn't have that same level of support.
exactly. And that lack of support can lead to poor posture, muscle imbalances, and increased strain on the spine, all of which can contribute to back pain.
So it's not about having like a six-pack. It's about having the strength to actually support our bodies.
Right. And the good news is that there are a lot of effective core strengthening exercises that you can do at home or at the gym.
Like the planks that we were talking about.
Planks are great. They engage multiple core muscles simultaneously. You can also do bird dog exercises, bicycle crunches, side planks. Those are all good ones.
Yeah. It's amazing how much emphasis there is on core strength when it comes to back health.
Yeah, it's because those core muscles play such a vital role in stabilizing your spine and preventing injury. It's like building a solid foundation for your entire body.
Shifting gears a little bit, I want to talk about something that I found really interesting in the research we were doing, and that's the role of mindfulness in managing back pain.
Yeah, mindfulness is fascinating. And it's becoming an increasingly popular approach to managing chronic pain, including back pain. It's about cultivating, like a non-judgmental awareness of the present moment, including your thoughts, your feelings, and your physical sensations.
So instead of getting like caught up in the pain, you're just observing it.
Exactly. And here's the thing. When you observe the pain without resistance, without labeling it as bad or unbearable, it often loses some of its power over you.
That almost sounds too easy.
Yeah.
How does just observing your pain make it better?
Well, it's not about making the pain go away. It's about changing your relationship with it.
Yeah.
One of the sources we looked at shared this analogy. Imagine you're caught in a rip current. The more you struggle against it, the more exhausted and overwhelmed you become.
Yeah, you're just fighting a losing battle.
Right. But if you learn to float, to just observe the current without resisting it, you conserve your energy. And eventually, you'll find your way back to shore.
So you're kind of like riding the waves of pain.
Exactly. It's about recognizing that pain is a sensation. It's an experience. But it doesn't have to define you or control your life.
Okay, so that makes sense. But how do you actually practice mindfulness for back pain? Do you just sit there and meditate?
So you can practice mindfulness in a lot of different ways. Formal meditation is one approach. But you can also incorporate mindfulness into everyday activities. Like you can practice mindful walking, paying attention to the sensations of your feet on the ground, the movement of your body, the air on your skin.
So it's about bringing that same awareness to whatever you're doing.
Exactly. And the more you practice mindfulness, the easier it becomes to access that calm, observant state of mind, even when you're in pain.
So it's like you're training your mind to respond differently.
Exactly.
And there's actual research on this.
Yeah, there is. Studies have shown that mindfulness-based interventions can reduce pain intensity, improve sleep quality, and decrease stress and anxiety.
So it's not just like, some weird thing that people are doing.
Okay.
It's actually like
There's science behind it.
legit.
Yeah, and beyond the research, there are countless anecdotal accounts of people who've found significant relief from back pain through mindfulness practices.
Wow, that's impressive. So you're basically like using your mind to heal your body.
In a way, yeah.
Okay, so we've got physical therapy, medication, mindfulness. But when do we know that we need to go see a doctor? Like, what actually happens when you go to the doctor for back pain?
So the diagnostic process for back pain typically starts with a thorough medical history and a physical examination. Your doctor will ask you about your symptoms, when they started, what makes them better or worse, and any other relevant medical information.
So they're trying to get like a whole picture of your situation.
Right, and during the physical exam, they'll assess your posture, your range of motion, your muscle strength, and your reflexes. They might also palpate your spine to check for any tenderness or abnormalities.
So they're actually like touching your back.
Yeah.
Okay, and after that, what happens?
Depending on your symptoms and their initial assessment, your doctor might order imaging tests, such as an X-ray, an MRI, or a CT scan.
Yeah. Okay, and what do those tell them?
So those imaging tests can help visualize the structures of your spine, revealing any underlying issues like herniated discs, arthritis, spinal stenosis, or fractures.
So they're trying to see like what's going on in there.
Exactly. And once they've pinpointed the cause, they can recommend the most appropriate treatment plan, which might include medication, physical therapy, injections, or, in rare cases, surgery.
So it's a very like personalized approach.
It should be. Back pain is a complex issue, and there's no one-size-fits-all solution. Getting a proper diagnosis is crucial for ensuring that you receive the most effective treatment for your specific condition.
So there's a lot to consider.
There is.
It's good to know that there are all these different options.
It is.
All right, so we've got physical therapy, we've got medications, but are there other approaches that people might not be aware of?
There are. There are a number of alternative and complementary therapies that can be helpful for managing back pain. For example, acupuncture is an ancient Chinese practice that involves inserting thin needles into specific points on the body to stimulate energy flow and relieve pain.
Acupuncture, yeah. I've always been a little scared of the needles.
I understand, but a lot of people find it to be very relaxing and an effective treatment. And there's growing evidence to support its use for back pain. In fact, the American College of Physicians now recommends acupuncture as a first-line treatment for chronic low back pain.
Really?
Yeah.
So it's like it's becoming more mainstream.
It is.
What about chiropractic care? I've heard mixed things about that.
So chiropractors focus on the diagnosis and treatment of musculoskeletal disorders, particularly those related to the spine.
So they're like spine specialists.
Yeah, kind of. They use a variety of techniques, including spinal manipulation to adjust the alignment of the spine and reduce pain.
Is it safe?
So, like any healthcare practice, there are good chiropractors and not so good chiropractors. It's
Yeah.
important to do your research and find a licensed and experienced chiropractor who you feel comfortable with. And while chiropractic care can be very effective for some people, it's not for everyone. So it's important to discuss your individual needs and concerns with your doctor before pursuing any type of alternative therapy.
Right, so talk to your doctor before you go and do anything like that.
Exactly.
Okay, so we've got all these different treatment options, conventional, alternative.
Yeah.
But what about when is surgery an option for back pain?
So surgery is typically reserved for severe cases of back pain that haven't responded to other treatment methods. It's often considered a last resort when the pain is debilitating, or when there's a structural problem that needs to be corrected surgically.
What kind of structural problems would that be?
Some common examples include herniated discs that are compressing nerves, spinal stenosis, which is a narrowing of the spinal canal, and spinal instability, which is when the vertebrae are no longer properly aligned.
So it's like there's something actually wrong with the structure of your spine,
Exactly.
and they need to go in and fix it.
And while surgery can be very effective in some cases, it's important to weigh the risks and benefits carefully. Any surgery carries potential complications, and back surgery is no exception.
Yeah, there's always that risk.
Exactly. So that's why it's so important to have a thorough discussion with your doctor. Explore all other treatment options, and make an informed decision based on your individual circumstances.
Okay, so this has been a lot of information,
It has.
but it's really good information. It's good to know that there are all these different options out there.
It is.
Okay, so before we move on, I want to talk about lifestyle modifications. In preventing back pain, we've talked about maintaining a healthy weight, practicing good posture, but are there other, like, everyday habits that can make a difference?
Yeah, there are. Simple changes to your daily routine can have a big impact on your back health. For example, be mindful of how you lift objects. Always bend at your knees, keep your back straight, and lift with your legs, not your back.
Yeah.
Lift with your legs.
Yeah.
What about when we're carrying heavy bags?
If you're carrying heavy bags. Try to distribute the weight evenly. Use a backpack instead of a shoulder bag. Or consider using a rolling suitcase if you're traveling.
Good advice. What about our workspace? We've talked about ergonomics, but are there other things we can do?
Take frequent breaks to stretch and move around. Get up and walk around every 30 minutes or so to prevent prolonged sitting.
Yeah, those movement breaks are important.
They are.
And when you're sitting at your desk, be mindful of your posture.
Right. Sit with your back straight, shoulders relaxed, and feet flat on the floor. You can even use a lumbar support pillow to help maintain the natural curve of your spine.
These are all good tips. It's amazing how just these little things can make a difference.
It can.
Okay, so we've talked about physical things,
Yeah.
but what about the mental and emotional side? Any tips for managing stress? So one of the simplest yet most effective ways to reduce stress is to practice deep breathing. Just take a few deep breaths. Focusing on the sensation of your breath entering and leaving your body.
Yeah.
It's amazing how such a simple technique can calm your nervous system and ease tension.
Yeah. Deep breathing is like the magic bullet for everything.
It can be.
What about mindfulness meditation?
Mindfulness meditation is also a great practice. Even just a few minutes of meditation each day can help you develop greater awareness of your thoughts and feelings, reduce stress, and improve your overall sense of well-being.
So we've got to take care of our minds
Yes.
as well as our bodies.
Absolutely. Back health is an ongoing journey. It's about making conscious choices each day to support your spine and prevent injury.
This has been great. I'm feeling so much more like I can actually do something about this, and I'm not alone.
You're not.
There are resources out there.
Absolutely.
And there are things I can do to actually manage my back pain. Okay, so before we wrap up this part, I want to go back to something we talked about earlier, which is the power of the mind-body connection. It's amazing how our thoughts and feelings can influence our experience of pain.
It really is. It highlights the importance of addressing both the physical and the mental aspects when it comes to managing back pain.
So it's not just about treating the physical symptoms, it's also about having a positive mindset
Right.
and learning how to cope with pain.
Exactly. And that's where mindfulness practices can be really beneficial. They teach you to observe your thoughts and feelings without judgment, to detach from the pain, and to find moments of peace and calm even amidst discomfort.
It's like we have the power to heal ourselves.
In a way, we do.
Okay, so thank you for sharing your expertise with us.
It's been my pleasure.
Before we move on to our final thoughts, I want to encourage everyone to think about everything we've talked about. You know, the causes of back pain, the treatment options, the prevention strategies. We've covered a lot of ground, from understanding the causes of back pain to exploring a wide range of management strategies, both conventional and holistic. Think back to what you were doing before you started this deep dive. Were you sitting at your desk, maybe hunched over your phone, or driving in your car?
Yeah, it's fascinating how we often don't realize the strain we're putting on our backs until pain forces us to pay attention.
Exactly. So I want to leave our listeners with this challenge. Take a moment right now to check your posture.
I like it.
Are your shoulders slumped? Is your back rounded? Just bringing that awareness to your body can make a big difference.
Small adjustments can have a ripple effect throughout your day.
Absolutely. And remember, managing back pain is a journey, not a destination. It's about those consistent efforts, those small changes that add up over time.
It's about creating a lifestyle that supports your back health in every way, physically, mentally, and emotionally.
And one of the most empowering things we've learned today is that you don't have to suffer in silence. There are so many resources available, from healthcare professionals to therapists to online communities.
Reach out, connect, and keep learning. There's a whole world of support out there.
This deep dive has been packed with insights, and I hope it sparked a sense of curiosity and empowerment in our listeners.
Back pain doesn't have to rule your life. You have the power to take control and reclaim your well-being.
So true. It's been an absolute pleasure diving deep with you today. Thanks for joining us.
The pleasure was all mine. Until next time, take care of yourselves and those incredible backs of yours.